Okay, so now we're setting the first maxillary molar. First thing you do, obviously heat the wax up, get it set on there, mark the cusp tips, mark that ridge, the outside ridge. And before I start messing with the occlusal plane and all that stuff, I try to get it set basically where I want it. And if you did these two correctly, then these are easy. That's one of the key points in doing these time denture setups, is you really want to try to do each step the best you can, because it makes the next step that much easier. So if I set this in the right place, this is that much easier. And then if I set this one's much easier, and so on and so forth. The problem is if you set one, far up the line incorrectly, then you're setting the rest of the teeth, to that incorrect position. So you're going to end up having to do a lot of adjustments. So the first thing I'll do after I set this molar and mark them is I want to look down the edge. What I want to see is this central fossa, basically a nice line. And if you notice too, these dots make it real easy to see how in line these cusps are. I really want these cusps to be in a straight line, because that's going to be the number one. They're supposed to line up with the line on the occlusal table, but they're also going to be supposed to line up with the ridge down below. So that's the first thing I do. Make sure everything's good and in a line. The next thing I do is I want to make sure that the buccal cusps are in a line. So all the cusps, everything should be in a line along with the central groove. The next thing is you take a look here, and this is touching the occlusal plane, this is touching the occlusal plane, this one is also touching the occlusal plane. So I want to make sure that these are pretty in line. This one is supposed to be 1/2 millimeter up. And then when we move to the facial, I'll just move it this way, it's a little bit easier to see. So we know that this is 1/2 millimeter up from the occlusal plane. This thing is supposed to be in line with this one, so it's also 1/2 millimeter. So you basically want these two cusps the same height and these two cusps the same height. Next, I want this one to be 1/2 millimeter up from this one. So if this one's 1/2 millimeter up from this, it's going to be 1 millimeter up from this. And you can kind of tweak it and play with it just to where you think it's going to be. And the more you do it, the better you'll get at just kind of eyeballing it. To whereas, somebody like Dr. Bumer doesn't even need to use these occlusal planes. He just eyes the whole thing and gets it done. So once we get it about where we think we want it, we can go ahead and double check it. And another thing we want to do actually is something we had talked about before, and that's making sure that these marginal ridges suit those. So this one's good, and actually this one just happens to be good too. But if it wasn't, I would maybe press down a little bit, heat it up and press down a little bit, make sure that these are in line, because that's going to be really important. One of the things that I like to do also is mark ND, basically to color in the central groove. And the reason I do this is that it makes it easy to see kind of where, if you're lined up or not. Obviously it's not going to be a straight line, these things aren't completely straight, but you can kind of see that that's good, linear progression. The downside of this is that you want to make sure that you have extra time to clean up all this stuff before you turn it in, because this also, while it makes it easier for you to set, it also makes it a lot easier for them to grade, and so they can see little discrepancies if you're off anywhere. So make sure you clean this up really well, and we'll go through that later on how to clean it up. So we're basically going to check it now, and as you can see, we got pretty lucky here, but the mesial lingual cusp is touching. The mesial buccal cusp is about 1/2 millimeter up. This side is this cusp is about 1 millimeter up, and the internal one is about the same, about 1/2 millimeter. Or distal lingual is about 1/2 millimeter up. So one of the things that you can look for actually, and that you'll start doing, is when you look at this thing from the side. So if you're looking at this thing from the side, you want to be able to see, you want to start to see a shadow as the curve of Wilson gets a little bit bigger. So this one doesn't have any curve, it's totally flat because it rests on the plane like this. This one, you have some space between the buccal cusp, so you should see, looking straight on, you should see a little bit of a shadow on this cusp here, and that this shadow should be about equal to this shadow, because these are cusps, all four of these cusps are at the same height respectively. then you start to get more. You know, it starts to curve up with your curve of Spee and out with the curve of Wilson. So you should start seeing a progressively bigger shadow, and then when you get to the second molar, the shadow should flow. You shouldn't have any, you know, big discrepancies in the size of the shadow of these. And when I say shadow, I mean basically these cusps. You should be able to see them behind the buccal, the mesial or the lingual cusp behind the buccal cusps. So that looks good, and now we're ready to move on to the second molar. Again, the same way. You can use this when you're trying to set this one. You can use this to set that first one because it's the same height as that, just like we did pressing it down. The other thing you can do is when you're checking, the wax spatula is a good measure of the 1 millimeter for the distal cusp. So I just want to make sure that my wax spatula just kind of barely fits under this. So this is about 1 millimeter, and you can see that that fits nicely right under there. So we're good. And again, with this guy, that fits just barely under there. So that's perfectly for the perfect for the mesial buccal cusp. Okay, so we're ready to move on to the second molar.